Yes, proceed, sir.
Namaste and good afternoon to all. I welcome you all for this webinar organized by Federation Special Care Dentistry, the Autism Board. We have planned a series of awareness program, especially for parents as well as for the professionals in this month. The April being that Autism Awareness Month, we have series of program we have planned. In that, this will be the first program on the webinar side. And we have conducted offline mode about 2. That is one for the dental checkup, as well as one program we have conducted for sleep disorder as a for the parents awareness program. That is in the Mangalore, we have done offline. And today being a plan for the program for the parents, especially for the hygiene part. When I approached Dr. Mehnaz Abdullah, she agreed and accepted our invitation and to conduct this program for the, especially for NGOs as well as the parents. And I really appreciate her presence in this audience or in the virtual mode. I welcome Dr. Mehnaz Abdullah for this virtual mode programs. And I'll welcome Dr. Srinivas, President, FSCD, and Dr. Priya, Executive Committee members, and other board members, and as well as other listeners, as well as who are interested in this special care dentistry programs. And Dr. Karuna being the moderator, as well as Autism Board, and Dr. Nandlal is a co-chair, is also present in this group. I welcome all for this program. And today, we have the program is first webinar by the madam. Before that, Dr. Srinivas has to talk to the address the people, as well as Dr. Priya going to address the people. Following that, Dr. Karuna is going to introduce Dr. Mehnaz, and Dr. Mehnaz will continue the program later. Thank you. Have a nice day.
Thank you, Dr. Shambat. On behalf of Federation of Special Care Dentistry, I welcome all the participants and the experts to share their valuable information. I'm so happy that a topic of this sort is being conducted, because most of the times we only talk about the behavioral management, behavioral issues, and all those things as far as autism is concerned. But this is something different, but much more important than, or equally important as behavioral issues. When the child grows, the child goes through many stages in the life. Every stage is very important for that particular time. Being in dentist, we always look at the behavioral issues because we need to handle the behavior to treat the child. But as the child grows, there are so many issues which the parent would face, and menstrual hygiene is something is very, very important. And many times this goes clueless. Not many parents are even aware of it because there is a social stigma attached to it. People are worried even to talk about it. But a talk and a program of this sort will give a lot of unanswered questions, answers. Thank you very much, Dr. Shambat, and I sincerely thank the Autism Board and Dr. Nandalal and the rest of the stewards of Autism Board. We are looking forward many such programs to be conducted by Autism Board. In fact, the Autism Board of Federation of Special Care Dentistry has taken over than any other parallel. And in fact, the Autism Board is becoming a path leader to the rest of the boards. And I thank each one of you at the board for this excellent participation and choosing of this kind of offbeat topics to be delivered. Thank you very much, sir.
Dr. Priya.
Good evening, everyone, and a very warm welcome to the program conducted by Autism Board for the day. And on behalf of everyone and the organization, I would like to welcome you to this program. Before we kickstart with this program, I would like to thank Shambhat sir and the entire Autism Board for taking this kind of effort to create the awareness throughout the month. Thank you very much, sir. And it's like Namineni sir has already addressed everything. I would just like to add to it that as me and sir keep discussing, that Autism Board is on autopilot mode. So thank you so much, sir, for taking out time and spreading the word and creating awareness, creating mentorship, and more than anything, setting examples for everyone. We are of complete belief that Autism Board is one of the boards that will set benchmark for all the other boards. And not only that, it is one of its board of its kind globally, in India and globally. So with that, I would like to wish all of you best of luck with Autism Board, and a very warm welcome to Dr. Mehnaz for addressing this issue. With children with disabilities, and with the improving medical sciences, there has been a lot of transition from childhood to adulthood. Being a pediatric dentist, we have been seeing patients with special healthcare needs for very long, for ages. But when these children are transiting into adulthood, the problems become different. There are psychiatric problems, there are hormonal problems, there are various problems which are never really spoken about. And this is a sincere effort from Autism Board to touch upon such various sensitive topics. So with that, I'll request Shambhat sir to get the program going, and thank you so much.
Thank you, Dr. Thank you. Dr. Karuna, take over and please continue the program. Introduce the madam.
Yes, sir. A very good afternoon to everyone. It's my pleasure to introduce to you today's guest speaker. Dr. Mehnaz Abdullah is a practicing gynecologist in Mangalore. She did her MBBS from Anapoya Medical College, Mangalore, following which she worked as a tutor in the same college. Later, as an in-charge medical officer of birth center at Anapoya Specialty Hospital for about 4 years. She went on to pursue MS in OBG from Anapoya Medical College and completed it successfully in the year 2019. Currently, she is working as a consultant gynecologist in her alma mater and delivering care to the needy. Dr. Mehnaz stands unique from her fellow gynecologists because of her key interest in the treatment of gynecological issues in individuals with special needs and counseling of their caregivers. She has attended numerous workshops and conferences to update herself and has also been a resource speaker on various occasions. She is active in the field of research and has explored to know about the gynecological issues among females with special needs and to know caregivers' perspective on hysterectomy in intellectually disabled individuals. Alongside, Dr. Mehnaz has authored a handbook for caregivers of intellectually disabled females titled Menstrual Management in the Intellectually Disabled. Here I present before you Dr. Mehnaz Abdullah. Over to you, madam. We are all eagerly waiting to listen to your thoughts.
Thank you so much, Dr. Karuna, for the kind introduction. I'm sorry, I need to apologize. I need to keep clearing my throat. I just recovered from a bad throat infection. So would you share my slides, please? Like, I'm having a little difficulty from my side, if that's fine.
Praveen, is it possible that side? Praveen, are you there?
Yeah, sir. Tell me, sir.
Yes. That slide, I think you have to share it. It's already shared.
Yeah, I had emailed it.
Slide, sir.
Yeah, Praveen email ID, just check it. Is there with her? Already conveyed to him also.
1 second, sir.
Is not opening for you, Dr. Menas?
Some technical issue, sir.
Meanwhile, if possible, they can guide you. Just see.
Shyam sir, actually the mail is not received, sir. So need to share from their end, sir.
Okay, so I'll just try from my side again.
Just help her only then.
Yeah, sure. Ma'am, initially minimize the Zoom, ma'am.
Just a second.
Before that, close all the folders. Just open your PPT.
Yeah.
Yeah, then maximize the Zoom and go to the share screen.
Okay, my technical support, who is my husband, is just working on that. 2 minutes, he's just working on that.
Yeah, sure.
He will help you definitely, Shamla.
Just make me.
Yeah, can you make him a co-host? Your name Shamjas. Is that possible to make him a co-host?
Is the name of ma'am?
Shamjas.
SH, right?
SHEM.
In her name, next is his name. There is.
Yeah.
Okay. I hope it's visible now.
Yes, visible,
Visible, sir. Yes, proceed.
Okay.
Dr. Shamjas, your technical help is superb.
he is definitely.
Yeah, he's known for that. So I'll start. First of all, thank you so much, Dr. Shambat sir, for this opportunity, and especially the Federation of Special Care Dentistry. Like mentioned earlier, this is such an important topic. Many caregivers just don't know whom to approach, what to approach. I mean, when they think of menstruation in their, girls with special needs. So really, hats off to you, because menstruation as such is such a topic of taboo. We don't even talk about it normally. So where does that discussion come, or even thought come, when it's to do with intellectual disabilities? So today, since it's meant for the parents, I think the very important issue would be, how do I introduce menstruation to my girl who has intellectual disabilities? So the first point is to start early. Most of the time it does come in the mother's, thoughts, when they have a girl growing up with intellectual disability. Oh my God, how am I going to manage menstruation? How is she going to manage? What am I going to do? Her schooling and all that. And this thought is filed and kept away, thinking that, no, this time, she's still small. But the problem is, the earlier you start thinking, planning, the easier the transition is, both for the girl and the parent. Okay, so we need to start early, plan better, plan, what how you're going to introduce, and then work on it so that the transition is smooth. So why do we need to start early in our children? With intellectual disabilities, studies show that they enter puberty a little earlier. They may enter puberty a little earlier than their peers, neurotypical children of the same age group. One of the reasons may be that many of our children may have conditions like epilepsy, for which they take drugs like valproic acid. These drugs are known to cause early puberty. They can be a little weight gain, and we know that there is a threshold of weight beyond which a girl gets her menses. So when these effects are there, a girl with intellectual disability, autism, can go early into puberty. So to make this transition easy, it is really important that we prepare her beforehand to know what to expect. Okay, that's why starting early is important. Now, when to start? How early is early? So we know that menstruation is just one part of puberty. That we say that's the final thing, the menarche we call. Menarche is the first menses a girl has. But before that itself, the signs of puberty starts. The first one would be that suddenly there is a growth spurt. Okay, the child grows tall, and heavier, and changes like, hair growth, underarms, in the private area, and breast development. So this usually, once these developments starts, it is a gap. There is a gap of around 1.5 to 2 years before the periods actually start. Okay, so, and we know that these changes usually start at average the age of 9 to 10 years. So the ideal time to introduce your child to menstruation would be the age of 9 years, because we know that it takes a lot of time for our girls to understand, and for us also to know the best way to teach them. So always start early, which 9 years would be the ideal age. How is the next question. How depends on the level of intellectual disability. We know that some are mildly impaired, some a little more impaired, some are verbal, some are non-verbal. So it really, you need to individualize and see which one would be, which works best. So, in verbal, of course, it's a little more easier because they're a little more communicative. You can see how far they have understood. Use of social stories. Now, there are lots of websites available free. They give free resources where, they have these social stories where you can actually explain, take printout, explain to them what exactly menstruation is. Flashcards are a good idea, especially for those who are not very verbal and who are more visual. Flashcards are a good idea. And demonstration on dolls. We can actually use dolls which are, a little with the bigger size dolls, and demonstrate what exactly it is. Now, this is an example of some of the flashcards that are really freely available online. And I have given the, the URL of a website where they have social stories. So you could introduce them by, showing these flashcards, and it makes it easier for them to understand. Now, practically, when you think about teaching about periods, I think the first thing that we have to understand and we have to inculcate in ourselves is to be approachable. Like, many times we are so uncomfortable speaking about menstruation. Of course, things are better. It's not like before where, our mothers wouldn't tell us about menstruation. We come to know from our friends or peers, and, that's how we come to know. But now, yes, parents are a little more open. The girls are a little more open towards the parents. So it is better, but still we've not reached where we have to. So we have a little, reluctance in speaking to them. Sometimes, many of the times, the starting point may be from the child herself. An example, she sees, the cover of sanitary pads in your cupboard. And then she asks, Mama, what is this? And then you'll be like, no, it's nothing. And you just close the cupboard. I mean, that's the natural thing. We are sort of, ingrained that it is something that you're not supposed to talk about. And the problem is when you give those kind of vibes to the child, it really depends on what she thinks about menstruation. So be approachable. That would be an excellent point to start talking about it. That was a question, sometimes we know even neurotypical children, they ask, what is that? And that's usually a point where you can start. You could start by saying that's something like, diapers for ladies, for big girls. When they become big, they have something called periods. And then, you take out the flashcards and you show, and that would be a good point in starting. So being approachable, giving those positive vibes is really, really, really important. Because, our kids, they really pick on the vibes. They really, we know that, they really pick on the vibes, and it is stored inside. So it's really difficult to remove it once that thing sets in. So make sure you are approachable and you talk it out easily. Explain what to expect. So when you get in an opportunity, of course, make sure that this is at a time that she is comfortable. There's nothing else that's disturbing her, and she can take in what you say. So of course we need to make sure that at that time she is in a comfortable position, ready to listen. So when you explain what to expect, now if she's verbal, again, it's easier. You can assure her that something normal that every woman goes through. You can like mama goes through it, Didi goes through it. You can give examples like the girls around her, the bigger girls around her, we all go through it. And it is something that will happen every month. And it is what you expect is that there is, blood that comes out. Now, again, here, there's again so much reluctance for us to really show them what it expects. Like if you see the example of ads of sanitary napkins, you notice they do not show it as red, right? They use blue because it is offensive for many people. But here, for our girls, our children, I think it's really important to show them what exactly to expect, because they are so pure in their, they know what it is. You tell them what it is what it is. So when you show them, a good idea would be to demonstrate what a sanitary pad looks like. Use one that is there in your home and show them, open it, let them feel it. And then using red colored dye, you can actually show what it looks like, because the blood usually freaks out all of even normal people, so they should know what it looks like. Of course, it becomes a little easier when it's verbal. You can actually explain that it is blood, but it does not mean that you're hurt. It is something that happens every month. Things like we need to explain what it will feel like every month. She may have a little pain in her tummy area, the breast area. She may feel irritable just before her periods, and those things. And for all that, we do have flashcards, which makes it a little easier for the non-verbal, because you can show those expression cards and all that. And make sure you explain what to expect, what she will feel like, and keep on stressing that it's something that's normal, something that all of us go through. During all this time, like when you are speaking about it, make sure that you maintain the privacy that is necessary. Now, even though we say, yes, you need to speak about it, but there is some amount of dignity and respect you need to give the topic, especially our kids. Again, they're so innocent. You need to keep them safe. You need to explain to them, this is something that is private. You can speak to it through your mom, your dad, your parents, that's fine. Your teachers, that's fine, but you do not go and speak to strangers about it, okay? And even all the, changing of the pads and all that, when you make sure you stress on that, emphasizing maintaining privacy, that just like when she goes to the washroom or when she changes her clothes or takes bath, how the privacy is maintained, the same way, during when you're changing pads and all that, privacy has to be maintained. So this also will be a recurring point that will come when you are teaching her about periods. So there is this concept called practice periods. Now, once, we have talked about it, you have showed the pictures, and this, of course, is over a period of time, one day at a time, depending on how receptive she is. So once she has the theory knowledge about it, there is something called practice periods. Allow her to touch and feel the sanitary pad. Now, most of the sanitary pads nowadays come, covered with that, this removable cover. Make her remove it by herself. Let her feel the texture. Let her put the red dye over it and see what it looks like. Attach it. She can actually, give her underwear. Ask her to attach it, detach it. Teach her how to discard the pads. So initially, she gets, over the sensory issues about touching, feeling, and all that. So this initially they may be reluctant, but as you encourage her, you can actually start encouraging her to wear it. This is called practice period. She's not got her periods yet, but you're asking her to practice. So once she's okay, a little comfortable with the pads, and she's fine, ask her to wear it. This can cause, a lot of reluctance when they try wearing it, because the actual sensory part, because, it is quite a sensory area, right? So this is a little, I feel, the challenging part on then making them wear it. So how you do it? Okay, maybe, you know, just you can just for 2 minutes and slightly increase the time of their compliance. So initially they'll wear it for 2 minutes and, you know, they'll be like, no, enough. Try to distract them, try to reward them at the end of the activity. So initially, what is 2 minutes? You know, if you plan it accordingly, a good gap between days, and increase the compliance areas, we would suggest at least if she can wear it for 4 hours, one pad for 4 hours, because that's the minimum time that you need to change pads frequently when you get your periods. So at least if she wears it for 4 hours, that is great. Encourage her, and if she goes, you know, if she's fine with that, the next challenge would be try to making her wear it overnight. So of course, if you see the one day she's not acceptable, you know, she's this thing, just leave it. Let's not, you know, force her to do that. We can try another day. But this practice periods, I think, makes a very much difference, and it makes it much easier, this transition for both the parents, especially the mothers, and the child in, you know, when the actual menstruation starts. So I felt that this practice period thing is something that really should be started. So when you start, you will start at around 9 years of age. You will start with theory and all that, and maybe, you know, gradually, before, by the time she gets her periods, she would have to be comfortable, at least a little comfortable, wearing a sanitary pad. Sorry. Now, okay, once she gets her periods, many mothers have this issue that, you know, they do not wear the pads. They discard it. They're totally not compliant. So you know how difficult it becomes for the caregivers. They miss a lot of school days. So how do we increase the compliance? Firstly, try to identify the reason. What could be the reason that, you know, she's not compliant? Is it the texture? Sometimes, you know, some of the synthetic covers may be more irritating, especially when there's sweat and blood on it. So maybe you could try changing the brand. Odor, they, you know, they are very sensory, you know, sensitive to smell. So probably it's a scented pad, and, you know, the smell changes. Is it that? Again, try changing the pads. Wings, sometimes what happens is wings are the best. Pads with wings are the best, which helps it, you know, put the pad in position. Sometimes what happens is, you know, the child is quite active, the wings may curl, and the sticky side of the end may, you know, stick onto the skin, and, you know, it causes irritation to even us. So for them, when they're sensory, you know, overload they have, it becomes really stressful. So, you know, it's, again, this is a learning process for both the mother or the primary caregiver and the child. Like, it's just like a you try one, okay, it doesn't work, let's try the next one. Okay, so it takes time, but maybe these are some of the things that could be one of the cause which reduces the compliance of the child. Another thing would be if she's not really comfortable with the pad, maybe when the lesser days, you know, the flow is usually heavier in the first 2 days, and the next days when it's just spotting, you could consider using those thin panty liners, which is much less, what do you say, texture wise and all. It's much easier probably for them. So that would be one consideration. Of course, I've had few mothers say that cloth was ultimately, that's what worked out for them. Cloth, the basic good old cloth, which our, you know, grandparents used to use. Sometimes that's the best. And another way is involve her in choosing the brand. So you could buy those, you know, the starter packs of different, you know, companies, and show her, try to get her involved and interested in choosing it. So maybe that would sort of make her more compliant, because, okay, that's something of hers that she has chosen. Again, a difficult issue is removal of pads. I've had like mothers telling how, you know, they go to the washroom and they just leave it there, and they come because they just don't want pads. One way would be, you know, make it difficult to remove. Instead of, you know, using skirts during those times, try wearing salwars for them. You know, it's a little more difficult for them to remove pants or something like that. So that would be like a practical thing, like especially when they're school, maybe for 3 hours in school. I'm sure, you know, if the part of the uniform fine or something, that would make it difficult for them to remove. Other tips are avoid synthetic and scented pads. Now, again, the issue of hygiene comes. Sometimes they refuse to remove pads, or sometimes they just don't wear pads. So hygiene, maintaining hygiene is again a difficult area which most caregivers, you know, face. One way is to avoid synthetic scented pads, because like in the area I'm from, like I stay in Mangalore, and it's like really humid, that sweaty humid weather. It's always best to use things that are most closest to cotton, and avoid all the synthetic and scented pads which have lots of chemicals, which itself will increase the chances of infection anyway otherwise. Another tip would be use of period panties. These products are available online. They help the pad to be, it stays better. And, because our kids are so structured, sometimes having, separate stuff, things to be used for periods helps them. So the next point would be like making a period kit. So she can have a box in which, that's her period kit. When she gets her period, she goes to that box. Now you can put a few pads there. You can put disposable covers there, because sometimes if they find it rolling the pad, the used pad, to discard, it is, sometimes they may not really want to do that. So they can actually, you can maybe put disposable bags in that kit, pads, and this period panties, and maybe a separate towel, and the wash or something that you need to use. You can put that in a box, keep it where it is accessible for her, show her that this is the kit that you can use. Keep it in a place where it is private for her. Always try to keep the bin where she can discard it within the washroom or within the room where it becomes easier for her. So these are some of the practical tips that you can incorporate to make that transition easier. Then this, like, many of the mothers had this, like when with children go to school, sometimes they have a lot of heavy bleeding and all that, so maintaining hygiene would be a problem. Make sure you can actually keep a few pads in the school. I'm sure most schools do accommodate. They have helpers there who will help to change once in 3 hours if it's heavy. So you can maintain hygiene that way. Make sure the child uses only cotton garments, cotton undergarments, because that helps to breathe better. It prevents that odor and infection. Okay. So this is actually, in brief, this is about maintaining, how to introduce menstruation to your child. The most important one is to start early, plan early, and it makes the transition smooth. Practice periods, very, very important, because it is like a learning procedure. So, this just making them ready for it makes a big difference. Individualize. Now, the few points that I have told doesn't work for everyone, but you could use that as a skeleton and use it on your child, because you know your child the best. The primary caregiver is the one who knows what will work for her child, what will not. So using these as a guidelines, you can actually use it to individualize. How would you like to teach? Is it social stories, or do you want a demonstration, or doesn't that work at all, or is it just the flashcards? Make her involved. So it all depends on your child and you, and how verbal she is, and no one is the best judge other than you. So these are just like guideline points for the primary caregivers to use and to make this menstrual, the transition of a child through puberty to an adulthood smoother for both the caregiver as well as the child. So remember, nurturing a child with special needs does not come with a manual. It just comes with a parent that never gives up. So all these points that I told you, it is just something that you could probably work upon, but some things may not work, but doesn't mean that we give up. We go to the next, and I'm sure something will work out and it will go smooth. The transition will go smooth. Thank you. This is all that I have covered in this, and I just made it a little short so that we could have more time on question answers. So maybe it would be practical for everyone. Thank you.
Thank you, Dr. Mehnaz, for explaining beautifully and in detail about how to create menstruation awareness and how to teach menstruation hygiene to children with the intellectual disabilities. I'm sure your wise words helped magnify our cause in the best possible way. The webinar is now open for discussion. Audience, please feel free to ask your doubts, if any, to the speaker. You may unmute your mic and put forth your queries.
Participants, kindly unmute and ask the questions.
I think you can ask them to even speak in their, Kannada or local languages if they're comfortable.
Yes. Yes, you may speak in any language you are comfortable with. We can translate. Please feel free to ask if any doubts or any questions that you need to clarify.
Dr. Karuna, Dr. Shambhat here.
Yes,
Dr.
sir.
Vidya wants to ask one question just to clarify it's the doubt. 1 second, I'll pass to Dr. Vidya.
Okay.
We have explained very beautifully. Would you recommend menstrual cups to such children?
Yeah, I was expecting the question because such a rage, menstrual cups. But I don't think it would, how far they would, practically would it be? It would be, yes, for a caregiver, it's really easy if they could insert it. But again, from our cultural background, generally we do not, when they're not married, there is always a taboo against putting anything into the vagina. Though it's absolutely safe, you don't need to be married to use a menstrual cup. But how far a child would accept, having something in, if a caregiver could manage, yes, that would be good. Hygiene-wise, yes. For the caregiver, yes, because she just needs to insert in the morning and then remove it later. But how far it would be stress-free for the child, that again depends on the individual. But there's no hard and fast rule that no, you cannot use menstrual cups. But of course, the size and all would be a little difficult initially. But if she gets a hang of it, it's okay.
Yes, that was the same question even I wanted to ask if nobody would have asked.
Such a range, like menstrual cups, such a range, and something that's really good actually. Saving the environment, cost effective.
Yes, yes.
How far it would be practical for our children? I don't know. I think it depends on individual preferences.
Comfort matters. Yes.
Ma'am, you can unmute your mic and ask the question. She has raised her hand.
Thank you, ma'am. Thank you so much for the webinar. Am I audible to you?
Yes, you are audible, but there is some background noise is there.
Okay, కొంచెం సేపు calm గా ఉన్నా. Ma'am, am I audible right now?
Yes, you are.
Yes, ma'am. A wonderful webinar, ma'am. Thank you so much for explaining everything. I have a daughter. She is 12 years old. Is there any particular symptoms before starting of period? Can you explain me anything?
I didn't get the question. Is there a particular symptom?
Is there any particular symptoms before starting of period?
Before starting of the periods, is there any particular symptom? This is what she wants to ask, I guess.
Yes.
Mehnaz ma'am?
I think her internet connection got interrupted.
Yeah, she dropped her connection.
Yes.
Mehnaz ma'am, unmute yourself, ma'am. Yes, unmute, ma'am. Unmute.
Yes, I'm so sorry for that. My technical assistant did not work quite hard. Yeah, I'm sorry, I didn't get the question.
Yeah, she was asking before periods begin, is there any particular symptoms indicating, okay, so after so many.
Yeah. there is generally, we all know something called PMS, premenstrual syndrome, that's all of us have. Like, we know that we're going to get periods. Usually we have some kind of mood changes, mood swings, acne, break of, pimple breakout, appetite. Sometimes there's increase in appetite. So in my course of, what experience I have with children with intellectual disabilities and what their mothers have noticed is that most of them become a little more aggressive during that time. And the appetite, there's a lot of increase in appetite. Now that's because there are a lot of hormonal changes, even we go through that. But what makes them aggressive is probably not being able to communicate what exactly they want. So PMS would be something that can signal that this is probably the onset of menses, because I do agree that initially when they get their periods, it's not really regular. They just have like once in 2 or 3 months. So PMS would be a good guide to know that. I'm sorry, just I'll just I'm just putting my camera off because my internet is a problem, so the streaming becomes slower. I hope that's okay.
Okay, no problem.
Yeah, okay. So I hope I've answered the question. It is basically PMS. Now, troubleshooting, if I could just put a word on troubleshooting during PMS, just like what we need during PMS is TLC, tender loving care. That's what we expect, and that's what we should give our girls also. So when you know that there's something like that, try to minimize, whatever triggers, so some things trigger them. Now, if those loud music, bright lights not trigger them, make sure that you have a place that is quiet and calm. And food wise, the bloating sensation that is there is again aggravated if you give a lot of salty foods, pickles and those chips that they have, and too sugary foods also. So that would be troubleshooting, trying to make them a little more calmer during that one. And a lot of hugs, tender, like generally they like being hugged, some of them, so just hugging and lying down in a quiet room without any sensory stimulus would help. I hope that answers the question.
Yes. Madhumita, you have raised your hand. You have anything to ask? You may unmute your mic and put forth your query.
Hello, ma'am. Can you hear me?
Yes, we can hear you.
So my question is related to PMS only. So I wanted to ask how do we factor in PMS? Like, do we include it in social stories while teaching the child? Also, that our child may have some interoception difficulties. So how do we tell her about it?
Okay. PMS, again, explaining depends again on how verbal or non-verbal is. So social stories, many of times the mothers themselves, necessity is the mother of all inventions, right? So we go online, we see social stories, and you can actually think and make a social story which you feel would be, would be something that your child would understand. So yes, you could always use flashcards, especially like when you have PMS. It's usually the mood that is the issue. They're either irritable or they're sad. So you use those flashcards. Try to make them able to communicate this. Yes, what are you feeling right now? Show them flashcards. Is it this that you're feeling? Is it this that you're feeling? Is it tummy pain that you're feeling? So you have flashcards for all that. Use that to communicate, and that would probably help to the child also, because we know that a lot of their frustration is just not being able to communicate. That's the main thing. So when you are also trying to okay, is this, is it that, and they're able to show you, yes, this is what they're feeling, that itself half the distress is done for them. I hope that has answered the question.
Any more questions from the audience? Suresh sir, are you trying to speak anything? Yes, Lakshmi madam, you want to ask something again? I can see your hand raised.
Ma'am, can I ask one more question, ma'am?
Yes, yes, definitely.
Ma'am, actually, daughter is 12 years and my son is 9 years, ma'am. When I'm trying to say about pads, panties, I'm start teaching her what is pants and pads. Then he's involving in that, and he's trying to ask, what is this? What is this? Can you explain me, Mama? Why you are explaining all this about or about this sister? What's happening here? He's trying to ask, and he is trying to know everything. How can I give him predictability about this? Can I give or not? Please tell me.
I'm really sorry. I could just get the initial part. What exactly is the question? Because there's a lot of background noise. Maybe
yes,
would you
I'm
be
very
able to
sorry
type
for
it?
that. Yes, ma'am. Actually, my son is 9 years, ma'am, and daughter is 12 years. I started teaching about pads, panties, and all stuff like that. And he again starting that. Mama, why are you saying all this? What is this one? What is this one? Can you tell me about anything? He start asking. He start asking that. Can I?
The boy. Okay, the boy asked. Okay.
Yes. Can I tell him anything? Can I give him any predictability about that? Is that appropriate?
About the how appropriateness, are you asking?
Yes,
Like,
can I explain anything about pads and panties? Because he's just 9 years old. Can I say anything about
yeah,
pads and panties?
it's again, it's like it's no hard and fast rule that this is not to be told to boys, because they also should know. I'm assuming, is he having autism?
Daughter having autism and learning history, ma'am. He's a normal boy.
The daughter has. Okay, yeah.
Yes,
So
daughter has autism.
it is daughter has autism and your son is neurotypical, right?
Yes.
Son is fine. Okay. So all the more important that you teach, her brother. These are the things that the sister is going through, and she may be having these difficulties. So all the more, yes, I really appreciate that you have. I don't think any of our mothers have ever spoken to boys about menstruation. So really commendable that you're doing it. And I think, yes, he should know about it from the right source, and what source could be more, that there's more right than the mother. So definitely, yes, you can explain to him. Of course, tell him that there is still some amount of embarrassing things that he shouldn't tell it out in a crowd. It's quite embarrassing for you and your daughter. But these are things that are private. But yes, he should be explained the concept, and that would probably even help him to help his sister when she's having difficulty during periods. He would understand, yes, okay, she's having periods, so that's the difficulty, or PMS, and he will also try to as a sibling do his part in supporting her as she goes through menstruation. So it's really good that you have introduced, or you are trying to introduce this concept to a 9-year-old. Yes, he is big enough, especially the 9-year-olds nowadays. Yes, definitely. But of course, since you are the right source, it is all the more you deserve to tell him than him coming to know from some other sources. So yes, definitely.
Any more queries? Any more questions from audience? If not, shall we wind up the webinar, Shambat sir?
Shyam sir? Unmute, sir. Unmute your mic, sir. Unmute your mic.
Yeah, I think he's must be busy with something. I think from the autism board we thank the speaker for taking out time and making this an effective theme-oriented, the most wanted area where the parents would like to get the instructions. We appreciate in such a short time should agreed and also within a short period have delivered the necessary information. Thank you, madam, for coming over, and it was really useful information. I'm sure the parents would have more questions, but they can always come back and attend to the other sessions. Thank you for your time and being with the Autism Board to deliver and work for this Autism Month Awareness Program. Thank you.
My pleasure, my pleasure.
Shambar sir just called saying he's unable to unmute, so he has told to wind up the webinar.
Sure,
yes.
Sure. Thanks to the parents and all. You can thank everybody and the organizers as well. Yeah.
Yes.
Yes.
Thanks
Karuna,
to,
can conclude.
thanks
Go ahead,
to the
Karuna.
president.
Thank you for the conclusion. Thank you.
Yeah. Thank you. Okay. Bye.
Yeah. A heartfelt gratitude from Autism Board, Federation Special Care Dentistry to our guest speaker, Dr. Mehnaz Abdullah. A big thanks to all the wonderful audience present here for your patient hearing and active participation. Thank you, Dr. Srinivas Namineni sir, Dr. Priya Verma madam, President and Secretary of Federation Special Care Dentistry for your never-ending support. And special thanks to Nanlal sir for your presence and all the other FSCD members who are present today. And last but not the least, I thank Dr. Shambar sir, Chair of Autism Board, and the person behind this successful webinar. Thank you one and all. Have a grateful time ahead.
Ma'am, we'll end the meeting, ma'am.
Yes.